If you've been thinking about getting into healthcare, but you don't want to take the vitals, draw blood, or work nights on a hospital floor, there's a whole side of healthcare most people never see. It's built on data, records, and systems instead of direct patient care. And the people who do that work are the ones hospitals and health systems rely on every single day. In the next couple of minutes, I want to show you a path into that side of healthcare and show you how to see if it actually makes sense for you. My name is Kristen Eek. I work with Cambridge College of Healthcare and Technology. We offer a fully online Bachelor of Science in Health Information Management. It's designed for people who want a long-term career in healthcare, but on the information and systems side, not the bedside. Let me guess where you might be right now. You want a stable career. You like the idea of healthcare because it's not going anywhere. But every time you look at programs, it's nursing, medical assistant, clinical this, clinical that. And you're thinking, yeah, that's just not for me. So you land in the middle. Maybe you're doing billing and coding. Maybe you're at the front desk or doing data entry or fixing little issues in the system. You're the person who chases missing forms, cleans up errors, and everyone comes to you when something in the computer doesn't look right. You're good at it, but you don't feel like you're building towards anything bigger. In the back of your mind, there's this worry. What if I look up in 2 or 3 years and I'm still doing the exact same thing? What if I pick the wrong program and waste the time? The risk isn't some big dramatic failure. It's just working harder year after year without actually moving into the kind of career you wanted. This program exists to give you a clear path into the data and record side of healthcare. Here's how it works. Step 1 is simple. A short call. You click the button near this video, pick a time, and you talk with someone who works specifically with people looking at non-clinical roles in healthcare. They'll ask you where you are now, what you've done so far, and what kind of work you'd actually like to be doing day to day. Then they'll walk you through whether a health information management degree makes sense as a next step. If it doesn't, they'll say that and point you towards another option to look at. If it does look like a fit, then we look at how the school fits into your life. The program is fully online. You log in, you see exactly what you're studying each term, what's due this week and what's coming next. You can put it on a calendar around work and family instead of trying to guess. What you study is the information side of healthcare, medical terminology, electronic health records, healthcare data management, coding and classification systems, compliance, privacy and security, analytics. In plain English, how patient information is created, organized, protected, and used to help hospitals and health systems run. You'll also be introduced to certification pathways, like Certified Coding Specialist and Certified Coding Associate, so you understand how credentials in this field work. And you can decide what you might want to pursue after your degree. As you move through the program, you'll be building a profile that lines up with how real health information departments operate. Most people who end up in this program look a lot like you. There's the person who's been doing billing and coding for a while. They like working with data. They can tell their current job is just one small piece of a bigger system, and they want to move into the role that see more of that bigger picture. There's the person in an office or admin role at a clinic or hospital. They're already dealing with charts, records, schedules, insurance every day. They're basically the glue that keeps things moving, and they want a formal credential that actually reflects that. And there's the person who's just getting started. They looked at nursing and said, that's not me. But they still want a way into healthcare that feels professional and structured. Different stories, same theme, smart, detailed-oriented, wants to build something real. They just needed a defined path into the behind-the-scenes side of healthcare. This is a strong fit if you want to work in healthcare. You don't want to do direct patient care, and you're drawn to how things run behind the scenes, how records move, how data is managed, how compliance is kept on track. If you'd like to be the person who understands the systems more than the person at the bedside, that's who this is built for. If you're looking for something you can finish in a few months and instantly change everything, this isn't that. This is a bachelor's degree. It takes time and steady effort. But if you're ready to stop bouncing between short courses and entry-level jobs and actually build a foundation for a professional role on the information side of healthcare, this gives you something solid to stand on. The program is fully online, Bachelor of Science in Health Information Management. You can complete it in about 135 weeks while you keep working and taking care of your life. The curriculum covers everything you need to work on the data and information side of healthcare, such as records, systems, coding, compliance, privacy, security, and analytics. You also get exposure to certification pathways like Certified Coding Specialist and Certified Coding Associate. So you are building towards credentials, not just a diploma. It's fully online. You are not relocating. You are not quitting your job. You are just building the next thing alongside the current thing. I'm not going to pretend that this is a small decision. Earning a bachelor's degree is a real commitment. There will be weeks when you're tired from work and school is the last thing that you want to log into. But those are the same 2.5 years that are going to pass either way. The real question is, do you want to look up at the end of that time and still be in the exact same role, watching healthcare get more digital and data-driven every year? Or do you want to be moving towards the kind of behind-the-scenes role that actually fits how you like to work? The cost of doing this is the same effort. The cost of not doing it also is time, just spent without a clear path. If you've been looking for a way into healthcare that fits you, your brain, and your life, it's probably worth 15 minutes to at least get the details and see if this is the right fit. So here's what to do next. Click the button near this video and pick a time for a 15-minute career path call. On that call, you'll talk with an advisor who speaks with people every day who want healthcare careers with outpatient care. You'll talk through where you are right now, what kind of work you'd like to actually be doing, and whether a health information management degree fits that plan or if something else would make more sense. If it looks like the right direction, you'll leave that call with clear next steps, rough timeline, what to expect from the program, and what financial aid options may be available to those who qualify. If it's not the right fit, we'll tell you that. Worst case, you cross this off your list and move on with more clarity. You've been thinking about this for long enough. Take 15 minutes, get a real answer, and see if the data and record side of healthcare is actually for you. Click the button and book your call.